The development of Carolina for Kibera was not easy because one, we were coming into a community that was extremely volatile. Second, if you look at the history about Kibera and the development of the community, you realize at that time, nearly 70% of any NGO, CBO, multinational agency, they were all working in Kibera. CFK did not want to come and reinvent the wheel in terms of what other people were doing, but we really wanted to look in the aspect like how do we add value. More importantly for us was really how do we work with young people.
Carolina for Kibera was founded by 3 individuals, an American named Rai Bakut and 2 Kenyans, one Salim Mohammed and Tabitha Festo. Unfortunately, most of us never had a chance to meet and interact with the late Tabitha Festo. She passed away in 2004, just 4 years into the start of the organization and the operations in Kibera. And so over the last 20 years, we have gone through that, learned our lessons, made our mistakes, and gathered sufficient information that makes us feel that a good portion of our programs have been indeed successful in terms of creating impact and influencing policy at national and global level.
The earliest program we did within CFK was a sports program. And sports was very easy, and it was an easy program to design in the sense like we wanted to see a program that brings about very many young people in one environment and where we can now start addressing issues.
And we realized that sport is not just the physical being and also just playing for entertainment, but we realized that it is a serious platform that if everyone is given an opportunity to explore, then they could bring amazing things out of them. We've had individuals who have had a stint with the sports program through CFK and are doing amazing work outside Kibera, which for me is a plus with the many resources and the time that we've spent with them and the value that we now see that our involvement, our interactions with them has given birth to the steps that they've made in life.
My entry point to CFK was soccer. CFK not only gave me a platform to play soccer, but they also equipped me with skills and later gave me a platform where I could execute the skill I had gained to impact lives of young girls in this community. I am among the 60 young people who were awarded by Her Majesty the Queen at Buckingham Palace in 2016. The Queen Young Leaders Program identifies, celebrates and supports exceptional young people across Commonwealth countries who are taking lead to transform lives in their community.
I've got one of the first soccer balls that we used in CFK. Pretty simple, right? I mean, it doesn't take a lot of resources to pull together soccer teams. But it was we were thinking, okay, that Salim and I were going to build up an organization that would use soccer to bring youth together.
The second program we did was a program called Binti Pamoja, and Binti Pamoja means Daughters United, and at that time we realized the need in terms of inclusion of girls, especially young girls in development aspects.
We worked with a group of 12 girls who were part of the sports program at that point in time in CFK, and we started with just a photography project where they took pictures of their lives and told stories about their lives. And from there, listening to the issues that they brought up, we brought in sort of different sources of education for them on the things that they said that they needed. And very quickly the girls said, we don't just need a photography project, we need a program, we need a place where we can come and we can be with our friends and learn things and feel safe as girls. That's sort of how Binti Pamoja was born.
And we really wanted to create as well safe spaces within the community where young girls can come, discuss issues that affect them directly or indirectly, and be able to come up with solutions. Some of the stories they were writing, some of the stories, some of the pictures, and we ended up publishing a book called Lightbox. which we actually used. The gains, the profit we managed after printing the book is what sustained Binti Pamoja in the development of Binti Pamoja.
And you find that in our communities or in the larger community, being a teenage mother, you're perceived as an outcast in the sense that they look at you as a grown-up because you're already a mom. So you need to find ways of providing for yourself and your kid. So most of our teenage girls, when we found them, most of them were kicked out of their homes by their parents, and a good number had dropped out of school. So our major intervention was basically to take them back to school and find people who can relate with their issues. And of course we had to come up with different interventions such as capacity building for them, capacity building for the schools we are working with, coming up with an MOU just to have an agreement between the organization and the school that they'll accept the teenage mothers in their school regardless of their situation, and of course have positive parenting sessions with their parents. Like in 2018, the Binti Pamoja was actually changed to girls empowerment, basically to capture a lot of girls and young women, because we used to major with adolescent girls only, but we saw there was a gap. As much as we are impacting the adolescent girls, there was number of rising cases of teenage pregnancy. So we got a funding from the Novo Foundation, and it enabled us to reach to teenage girls. It was one of our best interventions because we reached out to like 1,200 teenage mothers. So our major intervention was basically to take them back to school and find people who can relate with their issues. With Carolina for Kibera celebrating its 20th anniversary and Binti Pamoja Girls Empowerment Program reaching its 18th year, I must say that it has impacted a lot of girls in the community, and it makes me a happy woman now to see a lot of girls making informed decisions, having the right direction in lives, through our Safe Spaces module. Safe Spaces module has been proven to be the best intervention among adolescent girls.
I began volunteer for CFK, I think it was around 2006. This was like right after high school. I graduated in 2005. And I was a peer educator. I joined CFK as a peer educator. So I got trained in peer education, and what I was doing with that we would go out and then we'd have like some little scripts here and there, scripts about teenage pregnancy, scripts about HIV and AIDS, about sexual transmitted diseases, and just try to see how we can educate the community, and through the scripts. And we used to do that every Sunday and every Saturday. And other than that, we'll be distributing contraceptives, so female condoms, male condoms, female pills, and we will try to find women that got issues that want to get tested, and HIV and AIDS or pregnancy or whatever, and then we'll talk to them. So we cannot talk about Kibera being a great place without mentioning a place like CFK. You see what I'm saying? Because CFK is part of what is making Kibera great, through giving all these youths an opportunity. They gave youths like somebody like me an opportunity to become something, and all the other folks.
The third program we did was Tabitha Clinic. It was a health program, and the health program came about through Tabitha, an amazing, remarkable woman called Tabitha Festo.
A typical day for Tabitha was one busy day because she was a mother, she was a mentor to many. She was the manager of her own facility, she was the doctor in her facility, she was the nurse, and she was the lab tech. She was also the cleaner in her facility. So looking at her day, say one day in her life, was, I'd say, busy and more engaging with the community than even the family, because she would ensure that everyone, like she could talk to every person, both who wanted healthcare services and those who just wanted advice.
Sana alikuwa nasaidia wale watoto wa street. Unaona kitambo hao watoto walikuwa wanaiba na saa ingine wameshutiwa na wamehepa na hiyo risasi kwa mwili, wanaenda kujificha. So usiku wangekuja walie waseme, oh sister, alijulikana kama sister, oh sister saidia. So Tabitha anawaambia ni vizuri tu muende hospitali. Anaambia tukienda hospitali tutashikwa.
The journey and the vision of Tabitha shows hard work, patience, resilience, and trust in the community that you live in.
We run the community health outreach program, which is our work with community health volunteers. And so these are people who have been very well trained to handle the basics of healthcare provision at what they call level 1 of healthcare service provision. One of our greatest focuses has been on maternal and child health. And when you have a focus on maternal and child health, then maternal mortality and child mortality becomes one of the biggest things you must prevent from happening at all costs.
We normally go to the community to identify severe and moderate cases of malnutrition, giving health talks in the community pertaining any health pandemic that is in the community. Over the last 2 years, we have been able to identify almost 1,200 children, but the cases of malnourished, severe and moderate were 600. They were treated and discharged.
Ilikuwa mwezi wa 8 last year. Nilikuwa nafua tu hapa kwa mlango yangu. Alafu hao dumu wetu walikuwa wanatembea wakiangalia watoto wako weight zao siko chini. Niuliza kama niko na watoto hii ndogo. Walipimwa mara ya kwanza, walipata weight zao zikiwa chini. Akaniambia vile nitakuwa na wapeleka kila Monday ili wapate vile wanaweza songesha hizo weight zao. Tokea hapo sasa natembea naenda naona weight zikiendelea improve. Kwa najua weight zao ni kidogo. Nilikuwa naenda clinic naambiwa weight zao ni kidogo. Lakini sikuwa najua mahali pa kujisaidia. Nilipata usaidizi na mafunzo vile naweza walea, naweza walinda. Nimejisikia niko sawa. Juu inanisaidia at least naona nini watoto wangu wana improve.
Several years ago, there used to be deaths of 0 to 2-year children. When you come every Friday there at Kamkunji, you will find the children, 5 or 4 children every week being taken to be buried. So we were wondering what were the causes of those deaths, and we identified it was because of malnutrition cases. It's either the child has kwashiorkor, edema, or lack of good food. So that is why I have seen nutrition has helped.
CHV ninafaa nitembee na mama 1000 days, kumaanisha ni wakati ako mjamzito mpaka akuje ajifungue mpaka mtoto afikishe miaka 2. Mipango yetu ni tuone kila mama amejua uzuri ya kwenda hospitali. Kama ni 80% ikuwe wameshajua uzuri ya kwenda hospitali, wamejua kuzalia hospitali, kutibu watoto hospitali. na pia watoto wote waende shule, isikuwe ati kuna watoto wamebaki kwa kijiji hawasomi.
Singepatana na watu wa CFK, singejua jinsi mtoto amelala kwa tumbo, hata singejua jinsi hii uvimbe ilikuwa kwa tumbo iko namna gani. Juu wakati wangu wa kuzaa ilikuwa imefika, hawangeangalia wajue iko namna gani, singejifungua vizuri.
Kwanza mimi naweza shukuru sana Tabitha Medical Clinic. Imesaidia sana kwa sababu imereduce hiyo rate ya wamama kujifungua nyumbani. So for Carolina being there imesaidia sana wamama kupata facility ya kudeliver, na iko around nikuja hiyo siku yenye nilikuwa nasikia labor nilitembea nikakuja. So ni mali unaweza manage kutembea, unaweza chukua hata pikipiki kuja haraka. Upande wa watoto imepunguza hiyo tabia ya mama kuwa ati mtoto ni mgonjwa na rasha naenda kununua dawa kwa chemistry, na unanunua dawa huwezi jua ni nini nafanya mtoto. So hospitali ni karibu, instead of buying dawa kwa chemistry, peleka mtoto hospitali atibiwe.
Tabitha Clinic is the first of its kind to start a maternity in Kibera. Tabitha Clinic has become like a cornerstone within the community where people can get affordable, accessible, quality health care. You know, Tabitha Clinic is the only health institution in Kibera that has an X-ray machine, and at an affordable rate. It's not that we want to be the first in doing things, but all these are solutions that we are co-creating with the community. You know, and at the end of the day, it's like we're designing interventions that are easily sustainable within the community.
So as far as COVID-19 mitigation and responses are concerned, since we had our first case way back in March 2020, CFK then took up the role of first just bringing the information, given the fact that COVID-19 was a new virus across the world. So then we would go beyond creating the awareness to disinfection of infected or potentially infected surfaces within the community, places where people gather, schools, churches, high traffic areas, and all those things. And then we went into the actual, what we call wash kind of engagements. And our focus has been on provision of hand washing facilities, because we were looking at sustainability. If I hand you a hand washing facility at the household level, we are more likely to own and continually use, as opposed to putting one across the street. Then besides that, we have the Education and Livelihoods program, which is our focus on young people. And we focus on education and livelihoods, and education in all forms. So you're working with young people from as early as 9 years all the way to 24 years, and all the issues that they go through, including access to education, mentorship, livelihoods development, financial literacy, and providing linkages to opportunities for employment, either as self or formal employment.
And so what we do is we basically do a recruitment exercise all across Kibera with the aim of identifying these young people. And so we, at the end of each term, that is third term, we send out a call for advertisement for people who want to join the scholarship, and we select needy but bright kids, and that's how we get to support them. And so the support is also we'd say the full package. We do not just provide a scholarship. We provide mentorship, we provide career development, and we also provide parents clinic or parents workshop.
As much as I've benefited with leadership trainings and reproductive health trainings at Binti Pamoja, CFK gave me the opportunity to complete my studies both in high school and university through scholarships award.
It's all different. I've been engaged with CFK for the last 10 years. It's been an experience cutting through different levels. First as a student, beneficiary, graduated to a volunteer and an intern. Eventually, I am an employed staff. and I was lucky to be among the selected beneficiaries.
The reason why I had to look for CFK is because I heard that they were giving some scholarship for people to join colleges and universities, and at that time I did not have any money to join the university. Even though I scored an A minor, I didn't have anywhere to go, so I was looking for means of getting money, help to go to school and further my studies. That is when I joined. And through that, CFK helped me. They raised some funds to enable me to go to school.
So over the past 3 years, we've engaged over 48,000 young people directly. Those are either students in school, those are, community soccer teams that we are engaging. Those are young people coming within our vicinity to access services. So that's the number we've engaged. For schools, we've engaged over 70 schools with quality improvement initiative. We've also engaged 5 TVET institutions within the vicinity of Kibera, just in terms of helping young people access education beyond just the basic KCSE that they have.
Looking at where we've come from and where we are, of course the desire has been that we should be in a position to do more and to probably reach more. And looking at that, of course, the question that begs us is where we are we in a position to do that? And what limitations do we face?
And our director always made a joke, in fact, that we were now transitioning from being teenagers to adults. So it's at this point where you consider that growth is inevitable. So as you become an adult, what next?
So we are now going into a year that's very exciting because we'll be doing feasibility studies, baseline surveys, and eventually establishing an expansion plan on how we'll roll out our services across 8 counties. We have Nakuru, Kajiado, Machakos, Kiambu, Kisumu, Mombasa, and Kilifi. Nairobi, we seek to move from just Kibera to other informal settlements within Nairobi as well, especially those that we feel have been underserved for the last many years.
So our expansion process, or more so plan, has been in the making over the last 3 years. One of the strategies we are considering through partnership is working with like-minded organizations that exist in the counties that we have started to work in. So CFK has had a variety of partnerships over the last 20 years, ranging from the government, foundations, both local and international, also organizations, these are NGOs, and also private sector companies. And they all have, in their different ways, contributed to our success and growth in the last 20 years.
The time that I was working in Kenya early on, we wanted to find a place where we could study how people relate to each other and how the relationships affect infectious diseases, because we were very interested in the impact of informal settlements and having so many people crowded together in a tight space with limited infrastructure, whether it be physical, housing structure or supply of water and sanitation and food, and what that impact would have on the way infectious diseases are transmitted, and the potential for an emerging infectious disease, like what we're seeing right now with the pandemic, to appear in a place like Kibera.
Carolina for Kibera, CFK, was an influencing grantee of the Voice program for 2.5 years. And what the program focused on was being able to get teenage girls back into schools, particularly teenage girls in the Nairobi area, in Kibera particularly. What Carolina for Kibera did when it came to implementing this program was be able to help about 300 girls get back into school after being either leaving school due to pregnancy, teenage pregnancies, during their secondary education. And what Carolina for Kibera did was get memorandum of understandings with about 30 schools in Kibera, so that to ensure that once the girls were pregnant, after they gave birth, they would be able to return to school, because teenage pregnancy is really a discriminatory process that happens towards teenage girls.
One thing about CFK is that the community have really owned up to, like, it's a community-owned organization, and it gives me much hope to see like most of our interventions are being supported by the community.
For example, where Tabitha Clinic exists today, the land was given by the community. And the community knows this is our facility and nobody can actually do anything to that facility. They provide security, they provide services within the community.
And one day, the CFK annual report ended up on my desk in New York City. And I read it and was really connected to it. One of the things I really was moved by was that it was partially written in Swahili. And I thought, how bold of them to write for a US audience in a language they don't understand. Because it was really, it showed me that they were willing to be different. They weren't just following the norms of what so many NGOs do. And one of the things that really drew me to CFK was that it was run locally on the ground. It was really driven and operated, and the decisions were made locally in Kibera. And so what that meant for me, for the US side, to serve as the executive director on that side, is that I really saw my role as trying to amplify the stories, amplify the successes, try to sort of tell our audience in the US what was going on in a really honest and authentic way.
I've been away from Kibera for 12 years now, and it still holds a special place in my heart because of the great work that CFK does for the community. It was really special to me to learn how people had dedicated their lives to helping others. The sense of community that Kibera has was really inspiring to me. That people who didn't have much still gave so much to their neighbors, their friends, the people they didn't even know. It was, I think, one of the greatest and most heartwarming pieces of my experience there.
I choose not to be technical in terms of looking at achievements and impact that you have created as an organization, and look at your achievements in the eyes of a beneficiary. And so if I walk around Kibera and someone tells me that there are fewer deaths from preventable causes, that more children can now access and complete basic education, that there are more people who are more knowledgeable about preventable diseases, and they have a way of living through that there is behavior change in terms of how people look at things and respond to them, and that there is community trust for people who initiate programs here, and they can work with them in terms of implementation. That for me is achievement.
We've seen a change in approach in terms of how NGOs are doing work in Kibera. And this we've seen in terms of where we've managed to assist many of these organizations to rethink in terms of their approach. I think that is extremely important in development work. And CFK has been at the forefront in terms of shaping that conversation.
I am just so gratified, and it's really fulfilling to see the organization grow and thrive. You know, all along, what we have said with the founding of CFK is that we don't want to exist just to exist. We want to exist and be solving problems throughout, and hopefully at some point we won't need to especially in Kibera in particular. of course there's a lot of need within the world, and so I am and on 20 years it's important to reflect and step back and sort of celebrate, but also to not get complacent and to be focused on the future, which I think is also very bright.
In a better place as an organization, then would say that CFK has grown immensely in that particular direction.
I think of CFK as a butterfly, where it has gone through the stages of growth that are inevitable in nature. So where you move from a pupa to a larva, and now I feel like we're at the stage where we're flourishing into the butterfly that we were meant to be.